Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron. I'm here to bring you cutting-edge insights and practical strategies from leading healthcare experts for your journey to prime health in both life and in business. So if you've ever been told this by the doctor when you went for your annual visit, they suggested you get some labs, you get the results back, whether it's in an email or maybe the nurse calls you and you hear the labs are normal, but you still feel off. Well, today's guest, Marcia Jones of Next Level NP, has spent decades helping women find answers where conventional medicine often stops, and she's showing healthcare providers how to do the same for their clients. Now, before we jump into the episode, because I know you're just as excited as I am, I have a quick message from our sponsor, Grow Solutions, where we believe every healthcare provider and professional deserves an exceptional growth partner to match their ambition and reach their potential. Grow Solutions is not an agency or a vendor. We are your growth partner, and we take a diagnostic approach to your business. We analyze where time, money, leads, or opportunities may be leaking. Now, we help eliminate stressors in your business, such as new patient or client acquisition, marketing and growth strategies, reducing operational chaos with proven systems, frameworks, and SOPs. And yes, we help with AI and those bots because they're coming for us whether we like it or not. So if you've ever thought this, I'm too busy to grow, I'm too slow to scale, or I'm too overwhelmed to fix it, we can be your growth solution. If you want to learn more, just feel free to reach out to me and DM me, and I'll get back to you and touch with you as soon as I can. But I want you to enjoy this episode because I'm excited like you are. Marcia, welcome to the Prime Health Podcast, and please tell us a little bit about yourself and what you do.
Hey, Derek, how are you today? Thank you for having me on. I am, as you said, Marcia Jones. I'm a nurse practitioner. I have been in healthcare for about 30 years. I always say it's who I am, not what I do. I've done everything in the career. I've started as a nursing assistant, worked my way up. I always was driven by a mission and a purpose with each level. So every step I took was for a different reason. I have done traditional healthcare for most of my career, transitioning into functional medicine in the last decade. I've been educating nurse practitioners, and since 2018, I think is when I first started that. I've done a lot of speaking. I've even, went as far as writing a book recently about some experiences that I have had in this wonderful career of healthcare. It's always evolving, and so I feel that I've been evolving with that. And my latest adventure in healthcare is with helping nurse practitioners to grow and expand their business and transform healthcare for women.
Yeah. Well, you said, Marcia, that healthcare is ever evolving. The truth is, you are, but some providers are not. So I think we're going to learn how you can help them, evolutionize their business if you wish. So that's good. I want to jump back kind of to the start. You've been in healthcare for a very long time. Was there a moment, something happened, a life circumstance or something that caused you to choose a career in medicine?
Honestly, I didn't know what I wanted to do. I'm from a very rural area, and I had no clue. So I thought, well, let me get a job and see how that goes. So I was a nursing assistant in a nursing home, and I loved it, loved my patients, and I'd watch the nurses and I'd be like, I can do that. Yeah. I'm going back to school. And so I did. And then every step that I went, I would do the same thing. I can do that. I'm going back to school. And here I am.
And you have your own program that allows people to go to school with you to help them grow themselves and their business, which is great. Yeah, perfect. So you say that your perspective changed when you became the patient. So can you take us back to maybe that moment? You don't have to go into too much detail if you prefer not to.
No, it really is
your practice, and then how that kind of helps you train the professionals as well.
It was very eye-opening for me because, like I said, healthcare is who I am. It's not just what I do. And I always wanted the best outcomes for my patients. I was very big on education. I'd spent a lot of time talking. I followed all the protocols, everything I was taught in traditional healthcare. I went as far as opening my own practice because I didn't agree with some of the way things were done in the bigger facilities. I wanted to spend time with my patients. And I did this. I went through, like I said, all the levels. I had reached the pinnacle of my career. I had opened up my own practice. I was so happy. And then I was like exhausted and having these weird symptoms. And honestly, for a while, I thought I had MS because it was like patches of numbness, just the craziest stuff. And as a healthcare provider, if you can't figure it out, you're even double scared because you're like, okay, wait a minute, something's really wrong. Went through all the testing, all the specialists. And in that process, I was offered antidepressants. I was told there was nothing wrong. I was told get more sleep. And all I could think was, if this is the way they're treating me as their colleague, what are they doing to other women when they come in with these symptoms? What is happening to people? And so, as again, I kept getting this roadblock to what was going on. I couldn't figure it out. Finally, I found functional medicine at a conference. I went to one of the booths and I was like, let me check this out. Went to the IFM training, the very first session. Within the first hour, I was like, oh my goodness, where has this been all of my life?
Yeah.
Why did they never teach us this way? Everybody thinks it's about, just supplements and diet and lifestyle, but there's so much more to it. It's so deep in biology and uncovering the root cause. Yeah. And so as soon as I went back, Monday, I was like, oh my God, I have to do this. I have to do this. Like I wanted every woman, to get to tell their story and to start really picking things apart for them to find those answers because it gave me hope. And I knew there were so many other women who needed that hope.
Yeah. So not only the women, like the patients that you would see, but you have, in a sense, transitioned, pivoted, as you have, it sounds, numerous times, and you've pivoted now to helping other nurse practitioners make sure that the patients that come into their doors don't fall into that same trap.
Yes, because I know what it's like to be on both sides. Like I said, you do the training, you do what you're told is right, but some days you get to the end of the day and you're like, I didn't help anyone today. No one felt better. I feel like I'm hitting a wall just as much as the patients are hitting a wall. And, I would go to multiple conferences. I would learn the information. I would try to put it into practice. And there was always something missing, or you'd have to go back and figure it all out while you're seeing patients, which can be very difficult, daunting. And then you kind of slip back into the old ways, especially when you're dealing with authorizations and all the roadblocks of traditional healthcare.
Right.
So what I've done is taken that and put it all together with all of my years of experience into being able to educate other nurse practitioners, not just how to learn it, but how to do it and how to have support in the real world, not the conference setting, in the big ballroom where you've got 500 people sitting there listening to the lecture, but truly how to do it in your practice with that patient in front of you. And then giving the support on the back end when, Monday comes and you go, oh, well, this one didn't have the textbook symptom. They had an outlier. So that's part of what I educate on as well, is how to bring all of that together and know what to do then and now.
Yeah. So as a nurse practitioner, why is it that you feel, which you should be proud of your profession, what you do, but why do you feel nurse practitioners are really uniquely qualified to really lead the future in women's healthcare?
Because we're in the front line. We are the most trusted profession in the medical world. We are the ones who sit with the patients. We have our background in nursing, so we're taught, how to sit and educate and handhold, have compassion, and look at that patient from a different view and a different perspective. It's about listening to their story and that educational piece that we give them. And with that, we are set to do amazing things. I really am out to transform the way that healthcare is done for women. And that's because that's what we're actually trained to do. And when we get to use our skills to the best of their abilities and not be compressed into a traditional system that wants those 15-minute visits, we're going to excel and we're going to make a difference. We're going to have a huge impact.
Can you, for the viewers or listeners that are watching and listening to this, can you help differentiate a nurse versus a nurse practitioner?
Okay. So a nurse, cannot diagnose and treat and prescribe. That is the difference. So at a nursing level, you're able to follow under protocols, do orders, a lot of hands-on patient skills. And then with an advanced level of being a nurse practitioner, then we add into the diagnosis and prescribing and treating the patient.
So direct access is a really easy way to say that. People can directly come to see nurse practitioners versus for them to see a nurse. Typically in a hospital setting, they have to be referred in to see them, or they're coming along with their physicians.
Well, the nurse has to work underneath of someone else, unless they're doing something just like a clinical educator, but they have to work under the orders of the facility that they're in.
Okay. And you started out as a nurse and eventually graduated into the nurse practitioner programs.
I did. And that's what makes us unique, is because you have to have been a nurse to be an advanced practice nurse. So I spent years in the emergency department and working at the bedside, learning how to listen to a patient, seeing all aspects of care. Yeah. So I know what it's like from every angle. And that's what makes nurse practitioners so special and so unique, because we've done it all and we can see every perspective. And that helps us to tap in to the ability to speak to the patients in a clearer sense, I believe, making it more understandable sometimes that they can, and relatable.
Okay. And it's interesting. I'll say from a personal perspective, one of my first jobs coming out of chiropractic college was working for an orthopedic surgeon. And there would be myself kind of triaging a lot. The nurse would be in there. And then the doctor would come in. I won't share the names of both of them, but the doctor would come in there and talk. And this isn't against other surgeons. I don't mean to, defraud anyone or any sense of the imagination, but he would talk, he would listen. And as soon as he would leave, close the door, and then the patient would say, "Okay, Amy, can you really tell me what's going on?" Like they were afraid, of course, sometimes to ask.
Yes.
Always knew to get their questions, go to the nurse. So you speak so true about it.
I worked for a neurologist. It was the same thing. And this was even as a nurse practitioner. We would go in together to do the assessments. And I would do the assessment. He would come back in with the plan. Anyway, he would walk out of the room and they'd grab me and go, "What did he say? Can you please put that in English?" And I'm like, "Yes." So that's why I say it's one of my superpowers, is being able to put it in English, like boil it all down from the big words, scary things, into like, okay, well, this is what this really means.
So from an educational standpoint, there's traditional medicine and the educational programs that are out there. They limit what nurse practitioners and women in healthcare have been doing. How are you trying to reshape?
Well, there's been a big shift in healthcare when it comes to hormones. So a lot of our education did not focus on hormone management of women, and a lot of traditional care and the educational system that we go through kind of lumps everything together. And we're finally coming out into an age where we're understanding that women are unique. We are biologically different than men. Our lab ranges are not the same. We cannot be put in the same categories that go from a 13-year-old boy to a 99-year-old, whichever gender, and give them a normal range. Go, "Oh, your labs are normal." And so that's why we really have to look at things in a better perspective and go, well, this is different for a woman who cycles hormonally every week of the month. How can we say that someone who has a different cycle every week and a different fluctuation should be fit into the same category as a man? Okay. And literally we are cellularly different. So we have to look at that when we're treating people, specifically women, because women, they statistically have more depression, they have more autoimmune disorders, they have a lot more issues with insomnia. All of these things are from a connection. It's the whole woman. When you look at her connectedly and you look at all of her different hormones, you'll understand those patterns that are making her feel like that. And instead of labeling her with a diagnosis, you can actually treat the root cause and the imbalance that's happening and turn things around. That's not the way that it's typically taught, though. We're taught to look at systems, diagnosis, prescriptions, not looking at the whole person and everything that's going on and all the differences between the genders.
Yeah. Especially in a hospital setting, whether you're speaking to a physician or a nurse practitioner. You mentioned earlier, I think you said 15 minutes, it's 7 to 15 minutes you have with patients. And how can you really, and depending on the length of time it's been since you've seen that patient, how can you understand what they've gone through? How can you put out a game plan or a treatment plan for them to move forward? And not only that, but as you're saying, too often women are kind of put on the back shelf. They just have to kind of deal with what they're given, and it's in here and it's not necessarily in here. The problem, it's more between, so let's give you an antidepressant, as you're saying. It's really unfortunate how many women are not treated fairly. I've learned this so much from the podcasts that I've had, but I love how you're trying to help other people help so their patients don't experience that, especially the women that are dealing.
Well, a lot of times when women come in, so typically, historically, women are the caretakers of a lot of different things. We have multiple responsibilities, and typically we're the last part, on our list to take care of. And so by the time a woman comes in, this is why I think they get a bad rap, is because there's so many symptoms and none of them seem connected, and they feel like they're losing their mind. And even the most skilled provider is going, whoa, okay, let's start with one thing at a time. Yeah. Let's, we've got to do this and then this and then this. But again, it's actually all connected. And when you are able to understand things like HPA axis dysfunction, that right there drives most of the problems with the women that we're seeing. Because if there's an HPA axis dysfunction, then there's a hormonal dysfunction. We have a hormonal dysfunction, we've got a ton of symptoms. What I teach is that the symptoms are clues. We don't ever call someone crazy or, histrionic. We have to listen. We cannot blow off any of the symptoms. We also don't have to listen to them, list them out individually. When you understand the concepts of the whole body and the concepts of things like that HPA axis dysfunction and the hormones, you can go, oh, okay. And, but you can give them an answer usually within the first 15 minutes of, I'm going to give you hope. I'm going to tell you what's happening. It's not going to all be fixed right now. We're not going to give you a pill most often. But just learning how to redo that assessment and the way that you look at that woman that's sitting in front of you is the key to everything without just handing over a prescription.
Yeah. I want you to put on your clinician hat, if you don't mind, for a moment.
Okay.
So what are some of the most common overlooked symptoms that are presenting to an office that in a typical setting with a nurse dealing with in a hospital that they're missing?
One of my favorite things is, we all know about fatigue, chronic fatigue, but when a woman starts saying they're having hot flashes and it's instantly put out there that you must be in menopause or perimenopause, which perimenopause is actually a newer term. What we fail to look at, and the reason I don't just teach hormones, is insulin is a hormone. Insulin affects your glucose levels, which affects your weight, which affects multiple other things. And that is one of the primary drivers for the problems that women are having is insulin levels, which then leads to all I don't want to get into all the deep dive of all of it, but it's just the things that are so simple that we can address and ask the question, well, if you're having hot flashes, what time of the day is it? Is it really a hot flash or, do you kind of feel a little shaky with it or, asking all those other symptoms around it so that you can pinpoint, well, maybe their blood sugar is dropping because they have a dysregulation, which is one of the signs of the HPA axis dysfunction. Yeah. Or are they really having a hormonal shift that is related to menopause or perimenopause? And if we get a hormone panel, and that's one of the big things that I educate on, is a basic female hormone panel. It is not this cursory wellness panel that we do on people every year. That doesn't tell us anything. Fasting blood sugar, A1C, and a cholesterol level doesn't tell us anything. But if we add things like an insulin level and just a few of the hormones, even if they are a snapshot in the time that they were drawn, we can tell so much about that woman and really start to put her back together.
Yeah. Yeah, you answered the question I wanted to go to next, which is what are you teaching providers, which, that's one of the components. And it is like, why is it that when you go to your physician, he or she or your nurse, and they give you a panel and it's a generic panel? Why can't they take that step? And I understand it may be because they don't know how to read them, but still, why wouldn't you want to start advancing and evolutionizing your practice a little bit?
Well, it's multifactorial. For one thing, it's not taught. Like
Okay.
the whole hormone education, most of it is like, okay, birth control, obstetrics, gynecology, that's very minimal. The actual teaching of hormone management, especially in the menopausal, perimenopausal woman, is really new. And it takes about 20 years for the traditional healthcare system and our educational system of healthcare to catch up with the latest research.
Okay.
So unfortunately, what's happening is women are then going to things like TikTok and influencers and social media, trying to find their answers because their practitioner wasn't taught. And then we're in this other part. The other factor is insurance companies will only pay for a certain amount of testing. So you get this free screening every year. And my patients will always come in and go, well, just do what's free. That's what I want. I want my free stuff. So then there's education behind that saying, okay, well, if I do just your free stuff, then I'm not really going to give you any answers or give you, most of the answers you're looking for.
Mm-hmm.
And then we go from there with that conversation. But there's so much more that needs to be tested and a different way to look at it. We need to look for optimal ranges, not normal ranges. We don't want them to just be alive. We want women to actually thrive and, function and have a clear mind.
I love that. Not just to be alive, but thrive. That's fantastic. It's important. So from a differentiator standpoint, what do you feel that you do better than anyone else? And I think that goes to, you don't just mentor clinicians, but you also help them build their business. You want them to be successful. Why do those things of mentoring a clinician and growing their business, how do those go hand in hand with next level NP?
Well, so like I said, 30 years of experience here. I've seen a lot of things and done a lot of things. I've had multiple businesses that I've started. I found out through my career that I was actually an entrepreneur. I had no idea. But after I started about the fourth business, I went, there's something to this. I've done it all very well. And I've done a lot of the courses with marketing, all the things. And so I've been very blessed to have the opportunity to take advantage of these educational adventures and to put them into practice and have a lot of help. A lot of nurse practitioners don't have that. They're stuck there in that they've got to have their job. They've got to go to work. They don't have time to take all the courses. And functional medicine certification is, months, years, depending on which certification you take. So what I have done is taken all this experience, been there, done that. And this is a nurse thing. And nurses know it's called see one, do one, teach one. That's our motto. Okay. So I've seen a lot of things, done a lot of things, and now I'm teaching a lot of things. Good. And like I said, the way that they can do it now, because I know what it's like to sit in every position. I know what it's like to sit as the student that comes back trying to put it into action, to be the provider that's working for a healthcare system, or a big group practice that feels limited by what we can do. So I've seen all the roles, and that's why I want to boil it down into what can be done actionable for every woman that is coming to them, whether it's, in a private practice, a functional medicine practice, a group that they're in. But that's the choice of the nurse practitioner. But the other thing that I offer is that if they want to branch out and learn business, open their own practice, see things differently, do things differently, I can help them do that as well. Because it's really scary trying to figure it all out and do it all right from the beginning.
Yeah.
And so, especially if you're doing something like hormone replacement therapy, that's not something that is done in traditional practices. you have to step outside of the box. You step out into, a lot of times now it's med spas, or functional medicine practices, different entities. And
Mhm.
so I've, been a part of many of those. And that's what I want to offer the nurse practitioners that I'm seeing. You bring me what it is your interest is, and I'm going to help you make it happen.
Okay.
I have a
So
lot of perspective that can do that for them and give
yeah.
them support.
So you run some retreats. I think you can talk a
Mhm.
little bit about that if you don't mind. But does that mean that in some of these retreats you will have a nurse practitioner that is in an office and somebody that's looking to be a nurse practitioner, or somebody that's already has their own private practice, and you can bring both of those into your cohort that you do?
Yes, I can bring anyone of any skill level
Okay.
into the retreat. But the reason for the retreats, I have a mentorship and I have a retreat. There are two different levels. So the retreat is for that person who wants intense work. They want to walk away after 3 days with one-on-one time to me. I limit it to 6 to 10 max. I'm a wishy-washy. So when somebody says, please, can I get in? I'm like, okay, we'll try to stretch. But I really want the women, well, the nurse practitioners who have, you know, dedicated their time to this retreat to walk away with everything they want. I want them to have time with me to answer all of their questions, whether they're just starting a website, and they don't know how to do that, or they're still just trying to get a grasp on the women's, health in general. I'm there to mentor each one in whatever their path of interest is,
Hmm.
but it's always centered around women's health.
Okay.
So whatever their level of education is, we start with that. We can branch off into different groups during our time there together to where I get to work with them one-on-one. Now in the membership or the mentorship, that's more of a group action. There's like some foundational courses that they can take. And then we meet a couple times a month where they can come into the group and everybody can collectively, ask the questions, do case studies, things that they need in their day to day, as well as like a community support group that I go into every day. And if they had a question like, okay, I saw this woman yesterday, I don't know what to do because this isn't what we talked about, I'm going to say, okay, first of all, breathe. Here's what we need to do. And then, walk them through how to do it. So I have multiple levels of support for wherever they are, because I don't ever want someone to be intimidated. Because I remember what I was like 20 years ago. I'm in my 50s now, so I know what it was like to be that new NP, trying to figure it all out all at once and struggling with that, bridging that gap between traditional and functional medicine, which is where a lot of people are headed now. Functional medicine is the thing, it's the new trend. And,
Mhm.
I love it because it's the way I think it should be done. But
Yeah.
we cannot dismiss our traditional background because we're not health coaches. And this is actually something I get a little on my soapbox about is we're not health coaches. We are trained medical professionals. We're not just telling you to go out there and eat more, or eat less, move more. And I mean, no disrespect to coaches, but there is a whole different level of education to a nurse practitioner.
Mhm.
And that education is what we need to know. Okay, is this something that is life threatening, serious condition, or is it not? We're
Mhm.
not just managing hormones. As nurse practitioners, we are very educated and need to do that from the level of education, not just like, oh, I can't do that because I'm functional medicine here and traditional medicine over here. It has to be brought together. And that's the other thing I do is bridging the gap between functional medicine and traditional healthcare. So you can do it all in whatever setting you choose in your career path.
Yeah, it's interesting. In relationships, we tend to set boundaries. In healthcare, sometimes we often do not set a boundary and say, bring everybody in. I can do everything for everybody. Whereas that patient would love you just as much, or that clinician that you're trying to help would love you just as much if you knew your limitations and you referred them elsewhere. I don't quite understand why that still persists today.
I'm with you. I don't understand a lot of things. And it's, again, we're in an older generational system. I'm like, you
Yeah.
got to be careful the way you say things. Like our systems are evolving. We've said that from the beginning, and we
Mhm.
have to keep up with it. We can't keep doing things the way that we did. And setting boundaries with our patients is very important.
Yeah.
We want to give them the care that they need as much as possible with putting all the systems together, because I also don't believe in, now when I say, I should probably put in here, when I said I'm from a very rural area, I am that nurse practitioner that had the primary care office that did all the things. I did the knee injections, I did the abscesses, I did it all. And so they loved me because they didn't have to go to the orthopedist. They didn't have to do this. They didn't have to go, until it got to the point where I had to say, okay, listen, I cannot do all of the things. I have my limitations.
Yeah.
You're going to have to go here for this. You're going to have to go there for that. But where we are and what we need to teach right now, and this is what I teach to my nurse practitioners that work with me, is you have to look at the whole picture first. You have to do what you can do foundationally, because so many things are connected that look like they need all the specialists, but they don't really. And when you learn, and that's one of the biggest things that we do at the retreat, is when you learn how to take that assessment, and when you learn how to ask the right questions in just the right way, and your mind can start turning it around quickly, you can look for things that nobody else would have ever thought about. It's phenomenal to watch as practitioners learn this new skill of how to ask those different questions and how to put it all together, instead of that scared, like, oh my goodness, like all this stuff is coming to me at once and I don't really know which specialist to send to you first. I'm going to send you to all of them. Like, they're, especially for the newer practitioners, but we also are in a system where that's what they want us to do. A lot of our larger healthcare systems are forcing that referral that process of referring them everywhere. So I'm kind of old school. I don't like that until it's necessary.
No, that's okay. There's nothing wrong with that. It sounds like the nurse practitioners working with you go through a transformation in their business, in how they treat. And I think the benefit at the end is for their patients. So yes. I commend you for doing that. That's a good thing. From a business perspective, Marcia, what would you say is your focus right now on growing, let's say, next level NP?
Okay, so I have big goals. I want a nurse practitioner trained in my unique method, which is the way I assess patients, do women's healthcare in every state. I want one in every state so that we can have a referral base, and any woman who wants someone to listen to them and help them to find answers and give them hope has a place to go. Mm-hmm. No matter what state they are in, no matter where that nurse practice, because we have to be licensed in the states that we practice in. So I want to have someone in every state that can take care of these women who want a different type of healthcare.
Love it. Shoot for the stars. I appreciate it. It's good. So I would love for you to share a success story of one of these nurse practitioners that have joined your program and how it's kind of revolutionized their practice.
Well, I used to take them on with me in my practice, and I've kind of really narrowed this down into this 3-day retreat though. But I had, a nurse practitioner who came in and she wanted to work primarily with breast cancer patients, which is a little bit different. But knowing that I help with hormones, and this, I said, I can take anybody and help them. So breast cancer is actually driven by hormones. And it's driven by weight, it's driven by insulin, a lot of different things. So what I did over the course of the 3 months that she was with me, is I helped to educate her on all of the things functional medicine wise, but also what was driving these cancers, so that she could be an adjunctive functional medicine provider for oncology. So she did not want to be an oncologist. We can't overstep our bounds. We never tell people we're going to cure. But I taught her the business aspect. I taught her the hormonal relation to it. And she now has a very thriving practice where she's doing adjunctive therapy, the supportive therapy to chemotherapy, and doing a lot of IV stuff as well, like IV vitamin C treatments and just the whole gamut. So I'm so, so proud of her, but that was her goal. That was her vision. And that is what we did. We made it happen.
That's good. So it's almost tailored to them. Like, you have a program that can help everybody, but she wanted to go in a direction and you helped her that way, with a little bit of sprinkling on top of being able to reach about a lot of stuff.
Yes. Yeah. And that's what, when you understand the core of women's hormones and their health, you can take it in any direction you want to. You
Yeah.
just have to set the foundation first.
So what state is she in?
She's in Maryland.
Maryland. Okay. So that's, you got 49 to go. I'm sure you've got many more elsewhere, but you got
49 to
49 more to
go.
go. That's good. So if anyone is interested in learning about you and, next level NP, where would you like them to go to find out more about how they can make that decision? We'll share a bunch of links for you, but where would you like?
It's very simple. nextlevelnp.net. I'm all over social media. I'm all over. I got the website. Next Level NP is the handle everywhere you want to find me.
Okay. I'll make sure that we get that out. Thank you for that. So but again, put that that clinician hat on again. So if you could give us one piece of advice that would affect our health in a positive way, what advice would that be?
You have to lower your stress. I know that sounds so simple, right?
Yeah.
But there's many ways that you can help to lower your stress levels and to listen to your body and to not ignore what is happening to yourself, because those symptoms are clues and they're going to lead you to the answers.
Love it. Thank you for sharing that. I love asking these questions because I learn every single time from my guests. So thank you for that. Final questions. We go to wrap up here. You've been an amazing guest, Marcia, on the Prime Health podcast. What is your definition of Prime Health?
Oof, Prime Health is loving yourself and being able to function in everyday life full of optimism and positivity and looking forward to your next day.
So it was one of those books you wrote, Marcia, like Marcia's Positive Notes and Positive Thoughts?
I know that's probably not at all what you were expecting, was it?
Very good.
But when you feel good, you truly feel good and you're in your prime health, that's what it is. You're optimistic, you're positive, and you're looking forward to every day, every adventure.
Yeah.
That's
thank you for sharing that. It's very good. It's special and unique. I appreciate it. So Marcia, you've been a wonderful guest. I always tell people when they're watching or listening to this, our guest has something amazing to share. She went from, working in a nursing home and saying, I want to go to the next level, which is interesting because it's next level NP. She was always looking for that next level of where she wanted to go, then to a nurse, then a nurse practitioner. Now she wants to help nurse practitioners. So anyone that's listening or watching, please do her a favor. And for that person that that could benefit from this, share it with them. She's got a great story, a great message, and a great heart. You could hear that from it. Personally, from my perspective, we're always looking for people to share the podcast or subscribe to it because we love to have more amazing guests on like Marcia. But as I always say, until next time, remember, true wellness is a journey we are all on together. Now, whether you're taking charge of your own health or guiding others in theirs, every step forward matters. So please do stay committed to your Prime Health journey. And again, Marcia, thank you so much for being a great guest here on the Prime Health podcast.
Thank you.